I'm going to perform a basic respiratory examination today. This is at the Med 1 level for skilled clinician. Todd has kindly agreed to be our model for this. I'm going to start with general inspection. And what I'm doing here is I'm looking to see if Todd has excessive work of breathing or if his breathing is normal. Looking at Todd, I can see that his breathing is normal. His lips are closed and rested. He's not using muscles in the neck to help with his breathing. He doesn't have his arms back in a tripod position to help also with his breathing. So his work of breathing looks normal. I'm going to start my examination of the respiratory system itself by looking at his hands. There are a number of features of respiratory disease you can see from the hands. Peripheral cyanosis in the nail bed is one. It's also important to look for finger clubbing. Finger clubbing is an abnormal growth at the lower end of the nail bed, which results in changes in the nail shape. As I look, I can see that there is a normal angle in Todd's nail. In clubbing, the angle is such that it becomes obtuse rather than acute. There's also thickening at the nail bed, which is determined by the fact that the nail bed here is thicker than at the area of the proximal interphalangeal joint. There's abnormal sponginess at the nail bed called fluctuation, none of which I can feel in Todd. And Todd, can I ask you to make a little diamond shape with your fingers? And I'm looking for a rhomboid shaped window there. This is called Shamroth's window, and the presence of Shamroth's window greatly reduces the likelihood that the patient has finger clubbing. Thank you, Todd. I'm going to look inside Todd's mouth now to see if he has evidence of central cyanosis or bluish discoloration. Sometimes you can see that around the lips, but underneath the tongue is a good place to look. So Todd, could you open your mouth for me, please? Lift your tongue. I'm shining a light at Todd's tongue on the underside, and there's no evidence of purple or blue discoloration there. So Todd does not have central cyanosis. Thank you. I'm now going to take Todd's gown off, and I'm going to be looking at his chest for any abnormalities in chest shape or any scars on the chest, and I can see none at the front. And also when I look at the back, I can see no abnormalities in chest shape. I can see no scars on the chest at the back. I'm going to palpate Todd's chest. First of all, I'm going to palpate down the spinous processes. Todd, let me know if any of this hurts. And you can see I'm exerting relatively firm pressure as I do that, and there is no pain or tenderness there. And I'm going to do the same on the sternum. Just let me know if this hurts when I press on the sternum. And now I'm going to press over the ribs, back and front. And there's no tenderness in the chest. I'm going to see if Todd's chest has normal expansion. I'm going to start at the front and just ask him to take a really deep breath in. And I'm looking for the fact that the chest expands bilaterally and for a reasonable excursion. Breathe out. Normal chest excursion varies with age and also varies with gender. But it's important to have an idea of whether the chest is moving equally and symmetrically. This can be done from the back by using what's called the Bellows Method. So using the Bellows Method, I'm placing my hands in Todd's lower back with the thumbs closely approximated in the midline. Todd, could you take a breath in and breathe all the way out and stop. With the chest fully emptied of air, I'm now going to ask Todd to take a full deep breath in. And you can see the level of distraction of the fingers is quite significant, more than 5 centimeters here. Breathe normally, Todd. And that would represent normal expansion at the basal part of the chest. To do the same maneuver anteriorly involves placing the hands on the chest with the thumbs again in approximation. Deep breath in, Todd. And you can see that the hands lift up and the thumbs distract by a smaller amount. Breathe away. But that is also normal chest expansion. In diseases which restrict chest expansion, the actual expansion can be measured with a measuring tape for accuracy and reproducibility. I'm going to now percuss Todd's chest. I'm going to do this from the front and the back. Percussion produces a note that normally is called resonant under normal circumstances. If the percussion note changes from resonant to dull, implies that there's something abnormal within the lung spaces. So I'm going to start by percussing the apex of the lungs, and this is directly on the clavicles. You can see the percussion is done by the middle finger, and usually there's a wrist maneuver as well, which helps produce the percussion note. I'm going to come down into the rib spaces, and I'm percussing in the rib spaces, not on the ribs. And I'm comparing one side with the other. I'm going to do the same thing at the back. I'm going to start by percussing on the apex. Now I'm going to percuss on the rib spaces, being careful to be medial to the scapula. Those percussion notes are resonant all the way down. I'm just going to ask Todd to put his right arm over his head and touch his left shoulder as close as he can get to it. This opens up an area here which contains the right middle lobe. I'm going to percuss in the area of the right middle lobe. Thank you, Todd. And that's normal. The final thing I'm going to do is listen to Todd's breath sounds. Again, I'm going to do this from the front and from the back, and in the same places as I percussed. I'm going to ask Todd to open his mouth and to take deep breaths in and out each time I move my stethoscope. Breathe in and out. And again. And out. In and out. Again. And again. And then from the back, I'm going to listen at the apex. Breathe in and out. And again. Out. And again between the rib spaces. And out. And again. And out. Medial to the scapula. In. Out. And again. Out. In. Out. And in. Out. And again, if you could raise this arm for me. And then breathe in. And out. And again. And out. Thank you, Todd. You can put your arm down. So that concludes a basic examination of the respiratory system with inspection, palpation, percussion, and auscultation. Thank you, Todd.